There are several different takeaways. So the first, I think the biggest thing that we found is that, contrary to what was published in the literature, it is difficult to improve compliance to colorectal ERP process measures. Looking at our sample of 151 hospitals, we find that 85% of hospitals in our sample did not achieve substantial improvement. And this is defined as, improvement greater than 20%. And of the 663 total opportunities available for improvement, 80% of these opportunities did not achieve substantial improvement. And so the takeaway there is that, there's significant opportunity available to improve compliance to ERPs and in turn improve patient outcomes. Because prior studies have shown that compliance, high compliance leads to better outcomes. And then the other important thing that we found is that process measures that involve simple interventions like multimodal pain control or oral antibiotic improve the most by 23% and 16%, while resource-intensive process measures such as early mobilization, early solids, early liquids improve the least by only about 2 to 7%. And so even in a large sample of hospitals that were provided implementation resources like coaching tools, webinars, sample ERP toolkits, it was difficult. And so we have to look at these local contexts and the resource limited settings and see, how can we better implement these protocols and what can be done to, achieve better outcomes for patients in these settings.
So I think it just calls attention to in a very large sample of how the challenges with doing surgical quality improvement and the importance of it, and then the importance of us sort of coming together to make sure that we have the skills at the local level, the support, the knowledge, et cetera, to really be effective. Because this wasn't probably for lack of effort. People were passionate about trying to implement enhanced recovery, but it was challenging, and we need to, collectively figure out how to address those barriers and make this work easier.